Good afternoon, everyone, and welcome to today's Meet a Vendor webinar hosted by Abacus Health Solutions. I'm Christy Doe, Shortlister's Meet a Vendor webinar moderator, and I'm really happy you could join us today. Before I turn things over to our presenter, I'd like to review a few quick housekeeping items, especially for those of you who might be first-time attendees. Our Meet a Vendor webinars take place on Wednesdays at 1 p.m. Central Time. We use a condensed format of 30 minutes that includes a 25-minute presentation followed by 5 minutes of questions. To submit a question, go to the webinar widget right there on the right-hand side of your screen. There's a little tab for questions. You can type those in and send them over to me. We will get to as many of those as we can during the time that remains after the presentation. For Shortlister subscribers, our Meet a Vendor webinars are recorded and uploaded onto the Shortlister platform. When you're logged on, simply click the tab in the top right-hand corner. It says Meet a Vendor Webinars to access the recording. Additionally, you can head over to Abacus Health Solutions vendor profile to access the recording. So with that, I'm going to hand things over to today's presenter. We have Dr. David Ahern, co-founder and senior scientist of Abacus Health Solutions.
Thank you, Christy, and I appreciate the opportunity to speak with you all today. Our topic is mitigating the potential boomerang effect of the COVID-19 pandemic on employer health plans. Our agenda will focus on how reduction in care services will likely lead to a dramatic increase in costs for employer health plans, how utilization of telehealth and telemedicine can help keep patients on track. We'll talk a bit about the Abacus Diabetes Care Rewards Program, and then give an example of a Fortune 500 company case example. COVID-19, to no surprise to all of us, has caused a sharp decline in the use of healthcare services. And this graph shows in a pretty stark way the decline in use of healthcare services in the March through June timeframe of 2020. And you can see the different types of services and the impact that the pandemic has had. And that this impact would be to reduce the cost for the loss fund for an employer, but it may well be misleading in terms of what the future projected cost trend would be as a result of an increase in services and demand. You can see home health care, 3.6% decline, hospital care, a 2.9% decline, and physician care as well. The other factor that the pandemic has really highlighted is the racial disparities that are structurally in our healthcare system. This is not new news, but it's become much more apparent that persons of color are at greater risk for complications due to COVID and deaths, as you can see here. And these structural inequities in the healthcare system have been present, but now they're even more apparent, and we're seeing it as we play out, even as we move forward with the vaccine distribution. I'll give you a couple of other examples. In the cancer space, this is from an article in Science from Dr. Ned Sharpless, the director of the National Cancer Institute, where he talks about the projected excess deaths from colorectal and breast cancer from 2020 to 2030, related in part due to a lack of screenings and care. So we've been seeing a trend over the last decade of a decline in mortality from cancer. The concern is that the pandemic may well have an adverse effect on that positive trend, even reverse that trend. And these are some of the projections in cancer. With respect to diabetes, we know that people that have a relationship, an ongoing relationship with a primary care provider, cost about a third less. We know, as we saw in the previous slide, that there's been a decrease in the number of physician visits, understandably so, related to the pandemic because of concerns about going to a clinic, going to the hospital, seeing your doctor. But that has repercussions, and we'll talk more about it. We also know in diabetes that improvement in meeting care standards does have a direct bearing on clinical outcomes. So I'm sharing with you a list of the gaps or risks for diabetics in terms of their appropriate screenings in labs and exams. For a client of ours, where the baseline levels are listed on the first column, and then the current levels based on participation in the Diabetes Care Rewards program. So you can see here that by implementing a diabetes management program that continues, even in the context of a pandemic, we can achieve higher levels of adherence to recommended care standards, and we'll talk a bit more about that. The resulting effects of those increased adherence to care standards are reductions in the key metrics for cost drivers, particularly in diabetes, but also for healthcare in general, hospital admissions and hospital days. And here you can see for this particular client, for Abacus, the decrease over a 6-year period in hospital admissions per 1,000 as a result of the diabetes program. What we've seen with the pandemic in terms of testing is very much a concern in that Quest Diagnostics recently published their data in an article on population health management that 3 in 5 U.S. adults have avoided or delayed in-person health care during the pandemic. 1 in 3 Americans who have a chronic health condition such as diabetes have said their care has worsened. And 1 in 5 Americans have skipped or delayed blood work or lab testing. And in the case of diabetes, not doing regular blood glucose testing, particularly for patients with more severe diabetes, is a particular concern, and one that they're worried about the long-term impact of that decline in testing. So I'm going to talk about the Diabetes Care Rewards program for Abacus. It's a patented program from a behavioral science perspective to engage members with diabetes in preventative care to better manage their diabetes over time. And it really focuses on a set of target behaviors in the category of provider engagement and telehealth support. And the patented process is specifically around the use of behavior contingent incentives. So we've developed a process and patented that process that allows for incentives to be turned off and on depending on the adherence status of members. And we'll talk more about that. So these are the target behaviors in the Diabetes Care Rewards program. And there were the evidence-based standards promulgated by the American Diabetes Association. So to close the gaps in care, you want to make sure that members with diabetes have at least an annual eye exam, foot exam, lipid panel, urine protein test, and a minimum of twice yearly A1C testing. And by adherence to these standards and ongoing support from a primary care provider or collaborative care team, it's proven to reduce hospitalizations, and we've seen that across our book of business. The Abacus telehealth support service, as part of the Abacus Diabetes Care Rewards program, includes our personalized diabetes health action plan approach, which is focused on doing a comprehensive assessment by a diabetes health coach or a clinical pharmacist experienced in diabetes care. It focuses on barriers to adherence to the care standards I mentioned. It focuses on improving care coordination and supporting any other complicating or comorbid conditions that a person with diabetes may likely have, such as hypertension or behavioral health concerns. Another facet of the Diabetes Care Rewards program that we think is really a critical one is the medication therapy management service that is provided by our clinical pharmacists. It really focuses on improving outcomes as it pertains to the medication regimen that many patients with diabetes are on. We often see as many as 6 or more medications for a given person. Some of those medications may be historical, that aren't necessarily needed, but nevertheless are continued. We see what's called polypharmacy in that regard, or there may be adverse reactions from these medicines in terms of interactions among them. And then we also, the clinical pharmacists are particularly astute at addressing the challenge of non-adherence to taking the prescribed medications. This is a very big issue in healthcare in general, and very much the case for diabetes and diabetes management. So our clinical pharmacists play an important role in what we say optimizing the medication record for members with diabetes. And then I mentioned this patented process for Abacus, this behavior contingent incentives. So the incentive model that is the most effective in our experience with our clients is that members receive a zero copay waiver on their anti-diabetic medications and supplies. So if they're using test strips for testing blood glucose and the like, those copays are also waived if the member is adherent to those care standards that I mentioned. And the process is one where we work with many pharmacy benefit managers across the country and can provide the data streams that allow for literally every day turning off or on these incentives depending on the status of the member. And from a member's perspective, it's a very positive incentive because it produces savings up to $100 to $120 per month for members with diabetes that are taking medications, as well as all of the support services that the program provides. Abacus includes a remote monitoring service as well, which includes additional member incentives to both engage members in their monitoring as well as to support their ongoing sharing of their readings with their provider and with Abacus. So we work with multiple vendors for devices and formulary groups to make sure that we can work with the member and their particular device and particular approach to management for remote monitoring. It's based on the clinical need of each patient. We don't necessarily believe that all patients need to be engaged specifically in a remote monitoring service, such as what we offer, but many can and many do. And that can include blood glucose monitoring for patients, as well as blood pressure monitoring for those members that have a comorbid hypertension or blood pressure control problem. And this data is shared with Abacus as well as with their provider, and it provides actionable data to the Abacus team and to the member's physician or provider team to support enhancing their control of their blood glucose or blood pressure or both. And we look at the pattern of change over time, not just individual readings, but diabetes is a disease for most folks that may be years long or lifetime, and really does need to be supported over the long term. Patient engagement is a very important focus of the Abacus program. There are many challenges to getting members engaged for a host of reasons. It's a difficult disease to monitor and manage. And we do both biometrics and screenings and exams, the Diabetes Health Action Plan I mentioned, and we also look at claims data to support the identification of risk and risk profiles for members. And with that information, we develop a tailored messaging approach to each member that can use email, text messaging, telephone calls, mailing to the home, and then feedback around adherence to the recommended standards for care. Abacus has an artificial intelligence and machine learning capability that we've developed over the years of our program, where we can identify a member risk and do a risk profiling upon their enrollment in the program using the data elements I mentioned earlier. And the AI is used machine learning to identify which members would most likely participate in a remote monitoring service and more personalized health interventions. And to date, we've been able to use our intelligence engine to identify future risk of hospitalization with a 78% accuracy rate. In terms of Abacus clientele, we've provided the Abacus Diabetes Care Rewards program since January of 2008, which is when we offered it to our first national large employer. They tend to be large self-insured employers, hundreds of organizations across the country and across multiple industries, and we've had numerous independent evaluations confirm the outcomes and results of the Abacus program, most recently the Validation Institute, where we presented the Health Value Award in 2020. So I'm now going to move to present an example, case example of a Fortune 500 company that has worked with Abacus for over the last 3 years, where through the access to medical and pharmacy claims, we're able to identify, again, members with diabetes and those at various levels of risk with other comorbidities, as I mentioned earlier. And we are able to use that data to do actual clinical and financial outcomes determination, not just estimated on the basis of the population size and the like from the literature, but actually based on real claims data. And we actually look at the entire diabetes population when we report to our clients, not just those that are enrolled, although I'll talk about a study that looks specifically enrolled versus unenrolled. And the reason for that is because of changes in health plan from year to year, health plan policies and elements, and changes in the population as well, make it difficult to do just enroll versus unenrolled for members. And actually, we believe it's a better index of the impact of the diabetes program. So for this particular Fortune 500 client, we have over 1,400 members with diabetes that are engaged in the program, which is about a third of the population of members with diabetes that have been identified in this employer. We believe in a care coordination, whole person approach. I think I've provided you a sense of that to change outcomes, where we perceive our role as supporting an individual member's primary care provider or their provider team. And in some ways, or in many ways, we become part of that virtual collaborative care team or primary care medical home model. We believe very strongly that can produce better outcomes in a more coordinated approach. And so it's not a standalone coaching or digital only solution, although we use technology a lot, but we really use highly trained nurse CDEs and clinical pharmacists, and they're all trained to be in motivational interviewing, again, from our behavioral science background. For this particular large client, there's a number of other vendors that provide services in addition to Abacus Health Solutions for the diabetes program. And part of the objective of the client was to make sure that all vendors collaborate to the extent possible or integrate where possible. And we've actually been able to do that with this particular client quite effectively with their on-site clinic, which is in one of the large facilities where we've been a part of that team or collaborating with that team with their benefit platform and benefit engagement team, the PBM for the client, their telemedicine vendor and telemedicine platform vendor, the wellness and health coaching services, their EAP, and the two health plans, TPAs that are part of the claims adjudication process for this particular client. And by doing this integration, we're able to share experiences and assist each other, frankly, in providing the highest quality care for a given member. So from some of the health plans have done grand rounds where we literally discuss high-risk cases that were shared together in providing both diabetes services and other case management services through the health plan. And that's been really very effective and helpful to the member and helpful to the client. So I want to get to the clinical outcomes because we're very proud of the history of the success of the Diabetes Care Rewards program. And this is illustrative of the kinds of changes that we can see across our book of business. So for this particular account, we saw a 16.7% increase in members with diabetes who become, where their diabetes is at a pre-diabetes A1C level of 6.5, in some cases, a diabetes reversal in that scenario. And importantly, those with very poor A1C control with a 9.0 or greater HbA1c, we've got a 44.2% reduction for this client. I mentioned the important metrics of hospital admissions in hospital days. You can see here from calendar year 2018 to 19, the reduction of 6.1% decline in hospital admissions from 18 to 19. This is all-cause admissions. Folks with diabetes often are hospitalized for other than diabetes-specific issues. There are more complications related to their diabetes, whether it's hypertension or cardiovascular complications or wound care issues and the like. And so we look at all-cause hospitalizations. And here's the hospital days, 6.7% lower in 2019 and in the prior year as well for this particular client, hospital days per 1,000. And in terms of medical claims costs, this is really a remarkable outcome. We don't guarantee this kind of impact every year for our clients that we've been tracking for multiple years over time. But you can see the overall cost trend for the non-diabetic population for this particular health plan was 7.4% from 2018 to 19, where it declined for the diabetes population to less than 1%. Which was really quite a dramatic improvement in the cost trend for this client. I mentioned earlier that we've also, as the Chief Science Officer for the company, I oversee the scientific foundation of our program, and we've completed a large scientifically controlled propensity matched study of over 3,000 members with diabetes across 26 of our accounts over the last 7 years. And compared those that were enrolled versus those that were eligible but did not enroll, but matched on a set of characteristics. And we just will be publishing these results, and let me share them with you. We're quite excited about this. In terms of the gaps in care, there's a 19% greater likelihood of a physician visit over the 12-month follow-up for those members who are enrolled versus unenrolled, a 38% lower all-cause hospital admission rate, 34% fewer hospital days, a 20% decrease in members with HbA1c greater than 9, a 30% increase in adherence to medication. As you remember, the incentives are based on copay waivers for meds, and importantly, a 21% lower medical trend. This paper I just got to proofs the other day, will be published in the American Journal of Managed Care in early March, and we'll be glad to send you a copy of that article when it's available. So coming back to where we are with respect to the pandemic, this has been horrific for all of us. It's cost lives, more than 450,000 deaths attributable to the COVID-19 pandemic. It has disrupted our economy, impacted people and family in so many ways. And it's really difficult to look at any silver lining, but I think there is a silver lining as it pertains to hopefully the healthcare system. It really has highlighted the importance of ongoing management of chronic illness, that looking towards telehealth and telemedicine, for example, as I mentioned, in the way Abacus provides its telehealth support services, is a way to keep people connected even if they don't go to the clinic or to the hospital. And that, I think, is going to stay with us in some hybrid form. We'll see how as this get further along in 21. It's really shown, though, the value of that. It's also increased attention and efforts to address disparities in healthcare and the inequities. And I think it's really timely that we do that. Certainly in the case of diabetes, there's a disproportionate burden on those of color. And we need to make sure that we're addressing those needs, engaging those populations as we continue our work going forward. So with that, I'm going to pause. As I look at our time, I think I've come within the schedule, and I'm going to turn it back over to Christy for any questions you may have.
Thank you so much, David. That was a really excellent overview of Abacus Health Solutions program. I particularly liked a couple of things. One was the medication therapy management services. I find that a true differentiator. When I've looked at programs out there, I think looking at interactions of medication is extremely important. And I really liked you walking us through that case example, including the vendor integration and collaboration, which I also believe is unusual. Seeing some real data was really helpful. So as you can see, for the attendees on the line, the Abacus contact info is in front of you. I'm going to leave that up on the screen. I encourage you to write it down so you can reach out to them directly. So we're going to move into our Q&A. We've had some good questions come in, and we really appreciate it. We'll get to as many of those as we can. with the time that remains. And if we don't have time for your question, again, make sure that you reach out to David and his team. Even if you just want a little more information, I would encourage you to reach out to get those study results. That sounded very impressive. And again, those are coming out in March, so next month. All right, David, here we go with the questions. Question 1. What role does comprehensive medication management play in managing comorbid conditions?
Great question, Christy. It plays a really important role. I mentioned hypertension and diabetes. Hypertension is one of the major comorbidities that actually creates the cardiovascular complications that can lead to hospitalization. So unmanaged hypertension in the context of diabetes is a big concern. And for many patients, in order to achieve blood pressure control, they need to take often up to two or even three medications. And this is in addition to medications they'll be taking for their diabetes. And so the right medications, the right schedule and dosing is really important. So that's one of the reasons why we've incorporated our clinical pharmacist team and our pharmacy into our program, because we've seen it so often, and that by optimizing the full medication record, and many times, I'll mention one other, that there's a behavioral health concern, so there may be psychotropic medications on board as well. It really takes an expert, and the clinical pharmacists have that expertise to understand ways to optimize the medication and increase the likelihood that members will stick with their meds and take them as prescribed.
Great response. And I do love that you mentioned, David, the mental health component and meds that might be related to that, because I think we've all seen during the pandemic in particular that mental health concerns are on the rise, and certainly medication could be a piece of that. So thank you for that. So question number 2, what is the anticipated cost increase associated with unmanaged diabetes due to COVID-19?
Again, another very important question. First, let me say that I'm not an actuary. However, I've been told, or I've heard, that some health plans are requesting 7 to 7.5% increases, or are advising rather clients to prepare for that kind of impact related to COVID, both the cost of COVID and the services that were delayed or deferred, the elective procedures that might now emerge in 21. So it would be wise, I think, to look at that 7 to 7.5% as perhaps a conservative standard, because it may be higher with medical trend and costs that would normally be incurred as one goes year to year.
Perfect. All right. So we have an additional question here, and one that I think is really important. You mentioned it a couple of times actually during your presentation, but I would really like if you could expound on it. And that is, how does your program recognize and address healthcare inequities?
Well, I think, as I mentioned with the pandemic, it's become even more apparent that we have an inequitable system of care. We now want, as we kind of modify the way we deliver care using more telehealth, telemedicine, connected health solutions, that we want to make sure that we don't increase the digital divide when it comes to persons of color in minority populations, which means I think we need to just make sure that these services can be accessible to these populations. We need to obviously identify these population groups. And I'll mention Abacus is working with a client now where there is a significant proportion of members of the African American population who we know have historically not been as engaged in the traditional healthcare system for a host of understandable reasons. And we need to be better at communicating the value of these services and making sure that the messaging and the efforts that we make are culturally sensitive. And we're working actually with a diversity team for this client to focus on those topics. So I think we can do a better job I think we have to acknowledge that those gaps exist, and we need to work hard at increasing engagement for those populations, because I think they have a lot to benefit from, and we want to make sure again that we don't increase the disparity that does already exist.
Thank you so much, David. We appreciate the effort you and your team put into today's presentation and for making the time to share it here with the shortlister community. For our attendees on the line, we always appreciate you tuning in to our Meet a Vendor webinars. And we want to encourage you again to reach out directly to Abacus Health Solutions team if you have any further questions or you want to learn more. With that, we've reached the end of our time together. Again, thank you all for joining us, and we look forward to seeing you on the line for our next Meet a Vendor webinar on Wednesday, February 17th at 1 p.m. Central Time. Until then, please take good care, everyone, and have a great rest of your day.
Thank you.